Hello, I'm Dr. Mike Hagaman. I'd like to take this opportunity to welcome you to Physicians Health and Fitness Center. We appreciate you coming out today and spending some time with us, and we hope that over the next 45 minutes that we can better instill some knowledge about why we have a weight problem in America and what we can do to help you. Now, the first thing I'd like to let you know is this is not a sales pitch. We're going to give you some good general information that you can use in your everyday life, and then we'll let you make the decision of how you want to instill that. It's fine to take this information and go out and use it in your everyday life, and we wish you the best of success with that. Let me tell you a little bit about this program. HMR stands for Health Management Resources. This is not a program that I made up or that I created. HMR has been in the business for approximately 25 years. They are the leader in medically managed weight loss programs. They have about 450 clinics throughout the nation. The reason you don't hear a lot about HMR is because they go by different names, such as Physicians Health and Fitness Center. There's a program in Jonesboro at St. Bernard's. There's one in Fort Worth called Harris Fast, and they've been very successful. If you look at what's going on in the world right now, obesity is the second leading preventable cause of death in the United States. We're looking at over 450,000 deaths per year just associated with obesity. Now, why is it causing death? Because it is a leading predictor or leading cause of diseases such as heart disease, high cholesterol, hypertension, certain cancers, Alzheimer's, dementia, osteoarthritis, and type 2 diabetes. If you look at just what's going on with type 2 diabetes, over the past 30 years, we have seen a 650% increase in the diagnosis of type 2 diabetes. The expense of this is roughly about $200 billion per year. So I think it's obvious when you're looking at these diseases to see that our economy cannot sustain that type of growth. At Physicians Health and Fitness, we're trying to make people healthier, and we're doing that one person at a time. I know that I cannot change the world, but I know we can change one person at a time. The neat thing about change and becoming healthier is that you become a role model for others in your life. For each person that comes through this program and makes a significant change in their health, they affect 2 to 3 other people at a minimum. And that has been the neatest process of this business, is that we are seeing people in this town, I like to call it the domino effect, but we're seeing people that are losing weight, getting healthier, that are not necessarily involved in this program. And I think that is when we know we have had some success. Now, when you leave today, you've got a couple of choices to make. One of those choices is, I'm going to take this information, I'm going to use it in my everyday life, and maybe I don't need this program. And that's fine. We encourage you to do that, and we'll do anything that we can do to help you. There are some other options that involve joining our program. Our healthcare educator is going to spend the next 45 minutes or so going over all the details, to include the costs, the commitments, anything that you would have a question about. Hopefully she's going to answer. And then she's also going to give you some time at the end where you can ask questions about that. We understand the problem. I have 8 employees here, including myself, and over the past 15 to 20 years, we have lost a combined 500 pounds and have been able to keep that weight off. We know what the problem is. We're sensitive to your struggle, and we are here to help. And by the way, we have not lost all that weight on this program. I wish this program would have been available to make that easier, or at least more structured for us, but it wasn't. And that's one of the reasons that I brought this program here, is because I do recognize the need for treatment. And that's something that as physicians, we were not educated in very well, and something that I felt like as a physician that I was not doing very well. At times, I just felt like I was handing out one prescription after another to treat diseases that could be treated other ways, and certainly could be treated better ways, and possibly eliminating those diseases. Let's face it, right now, all we hear about is the healthcare crisis in America. I would challenge you on this. Do we really have a healthcare crisis, or do we have a health crisis? Okay, we've got the greatest medical system in the world, but yet when you look at where we rank on a healthcare standard compared to other nations, we're anywhere from 40th to 45th. We're not doing very well. We're spending twice as much as any other nation, but we are not getting the results. We wish you guys the best of success. I'm going to turn it over now to our health educator, and I hope you guys have a great meeting. Thank you.